Hello and welcome to this webinar on the NIHR Global Health Research Professorships Awards. The webinar will be delivered by myself, Hayley Mabelson, Senior Programme Manager at the NIHR, with a pre-recorded video from Professor Cara Hanson, the NIHR Global Health Programme Director, and the co-chair of the NIHR Global Health Research Professors Funding Committee, Professor Shireen Hussain. The webinar will include an overview of the NIHR Global Health Research portfolio and the new strategic remit of the portfolio delivered by Cara Hanson, some more information about the professorships and the application process, and finally, Professor Shireen Hussain will give some more information around what makes a competitive professorship application. There'll be time at the end of the webinar for questions and answers. So firstly, I would like to pass over to Cara Hanson, who will present on the portfolio.
Hello, my name is Cara Hanson. I'm the Programme Director for the NIHR's Global Health Research Programme, and I'm very pleased to be here today to share with you information about the Global Advanced Fellowships and the Global Research Professorships. Since NIHR was established in 2006, our mission has been to improve the health and wealth of the nation through research. And we deliver that mission through 6 core work streams, one of which is funding applied global health research and training to meet the needs of the poorest people in low and middle income countries. Across our research programs and partnerships, we've directly funded research in over 400 institutions worldwide and in more than 60 low and middle income countries. We've invested more than £700 million since we started funding in 2016. And we currently have 153 active research awards, 24 of which are directly contracted with low and middle income based institutions. NIHR has supported more than 1,000 individual researchers in low and middle income countries to progress their careers in global health. And we have currently 548 trainees. Our Global Health Research portfolio, which is funded through official development assistance, was established in 2016 and has grown significantly since then. Our current portfolio funds research through 4 different schemes. 2 of these are individual awards, the Global Research Professorships and the Global Advanced Fellowships. We also run an annual researcher-led call on a particular theme of interest. This is known as the Global Health Research Themed Program. In addition, we fund through partnerships with other research funders, leveraging budgets and expertise to address shared strategic priorities, to increase our research and impact, and to be in a position to act quickly in health crises. NIHR funds high-quality, policy-relevant, impactful applied global health research and training, and funds research that strengthens research capacity in both the UK and in low and middle income countries through mutual learning and knowledge exchange. Research should inform the development and testing of innovations, including clinical trials, support health systems to prevent and respond to health security threats, and provide insight into implementation in existing health systems in order to support deployment in real-life conditions and expanding to scale. Projects should involve community involvement and engagement and equitable research partnerships. By partnerships, we mean that relationships between northern and southern institutions should be fundamentally based and prioritize perspectives from the global health, be accessible to and involve stakeholders from both the global north and south that are committed to rebalancing power, and involve a fair distribution of resources, decision-making, and responsibility. NIHR expects project teams to involve community members in a meaningful way throughout the research process. We want to ensure that research is relevant to local needs, that the voices of marginalized people are heard, to build trust and increase the acceptability of interventions, and that these relationships should involve two-way communication and feedback. Research must demonstrate how it strengthens research capacity in low and middle income countries and in the UK. This can include supporting formal trainees, for example, through master's and PhD training. It can involve more experienced team members supporting early career researchers to take increasing levels of responsibility. It can involve sharing learning between collaborators, including from the Global South to the Global North. It should involve creating diverse research teams with a range of skills, for example, working across disciplines and working between academics and clinicians. And it should enhance organizations' ability to secure future research funding. These three elements, promoting equitable partnerships, community engagement and involvement, and strengthening research capacity, are fundamental pillars on which global health research funded by NIHR rests. I now want to talk a little bit about the thematic priorities in the current funding period. So our new thematic priority is to focus on global health security threats and challenges, and to support applied research that helps prevent, detect, and respond in the following areas. The first is vaccines, diagnostics, and therapeutics for infectious disease that have the potential to cause epidemics or pandemics. This includes applied research to evaluate interventions and social behavioral and implementation research to ensure that innovations are effectively adopted and scaled. We also are interested in research on pandemic preparedness, including research to inform policy and operational decisions, evaluate countermeasures, strengthen health systems and workforce resilience, and address social and behavioral dimensions. Our programs can support research on antimicrobial resistance with a particular interest in interventions that can be demonstrated to reduce the burden of AMR, including later stage trials and social behavior and implementation research to scale innovative AMR interventions, applied clinical and systems research to reduce any unnecessary antimicrobial exposure, and to optimize antimicrobial use. We can also fund research on infectious diseases of poverty, and by these we mean diseases which disproportionately affect disadvantaged populations such as malaria, tuberculosis, HIV/AIDS, and certain neglected tropical diseases, particularly those of parasitic, vector-borne, or bacterial origin. Disadvantaged populations should include vulnerable groups such as pregnant women, newborn children, and adolescents. And finally, we can support research that looks at how best to break the cycle between malnutrition and infection. Within these areas, we welcome applications that include research seeking to improve maternal, newborn, child, and adolescent health. Our geographic focus is the poorest and most vulnerable ODA-eligible countries and populations in sub-Saharan Africa and South Asia. For these programs, what is out of scope is research that is basic or discovery, that is not applied, research that's primarily focused on non-communicable diseases. Climate change is relevant insofar as it shifts exposure, transmission, resistance patterns, or population vulnerability to health security threats. Malnutrition research is only fundable when it's directly linked to infection risk or outbreak vulnerability, specifically including mothers, newborns, and children. Standalone nutrition research will not be supported. And finally, we will not support research that is directly involved in implementing disease surveillance. We are interested in research that tests new ways to improve disease surveillance. With that, I'll hand you over to the next speaker.
So moving on now to talk in more detail about the Global Health Research Professorships. So the professorships sits within the NIHR Academy. Within the academy, we develop and coordinate the NIHR's academic training, career development, and research capacity development offer. We manage a range of national and global competitions for training and career development awards, aiming to attract, train, and support the people conducting leading-edge research, and develop the skills of the next generation of health and care researchers to find life-saving solutions to key emerging health and care problems. And the NIHR Global Health Research Professorship is one of our flagship schemes, which funds research leaders to promote effective translation of research, strengthening research leadership at the highest academic levels, and supports researchers to conduct a research project in a strategic area of applied global health, receive training and development relevant to their needs, and also have protected time within your organisation, being relieved from administrative tasks. The scheme also aims to strengthen institutional capacity for research in low and middle income countries. So the award uses the ODA funding to support research and strengthen capacity to protect, detect, and respond to global health security threats and challenges, improving the health systems to protect the health of the poorest and most vulnerable in sub-Saharan Africa and South Asia. So within the scope that we described previously. You can apply for a 5-year award of up to £2 million, which will fund your salary as the lead applicant, an applied global health research project in line with the remit, some academic support posts to work with you in the award, travel for fieldwork, collaboration and training and sabbaticals, institutional capacity strengthening within the low and middle income country institution in your award, community engagement and involvement, knowledge mobilisation and research uptake, and research inclusion. So I'll now cover the eligibility for the award at the individual, institutional and ODA level. So firstly, at the individual level, who can apply? So the scheme is open to all health and public health and social care research and methodology professions. You should be close to professorial level or have recently been appointed as a full professor. And you must be employed by a higher education institution or research institution, either in an ODA eligible country within sub-Saharan Africa and South Asia or in the UK. And you must be nominated by your contracting organisation. At the institutional level, the contracting organisation will be your employing organisation and can either be, as I said, an LMIC HEI or research institution in sub-Saharan Africa or South Asia with a track record of research funding, or a UK HEI or research institution. And this organisation will have overall responsibility for the management of the award and should be able to manage the setup, running and reporting of a research project. And they must also be able to provide appropriate academic support throughout the length of the professorship. As I mentioned, you have to be nominated by your host institution or your contracting organisation, and each organisation can nominate a maximum of 2 individuals per round of the professorship. Where 2 individuals are nominated, at least one of these must be female. And in terms of partner organisations on the award, if your contracting organisation is in the UK, then you must have at least one partner organisation in an LMIC in which you plan to conduct your research. And that main partner must be a higher education institution or research institution. If your contracting organisation is in an LMIC, then you may wish to include other organisations to foster South-South collaboration, but this is not a requirement. And then in terms of the ODA eligibility, projects must benefit people living in one or more ODA eligible country within sub-Saharan Africa or South Asia. And within applications, you should outline clearly which countries will directly benefit and how your application is relevant to the development challenges of these countries, and then how the outcomes will promote health and welfare of people within those countries. Moving on now to the application process. This year, applications will need to be submitted through the new NIHR award management system, which you can find. The website is included here on the slides, but you will find this through our website as well. And then in terms of the assessment process, the application window, as I've described, will be open between April and June, and applications will then proceed to a funding committee review and be shortlisted. Those that proceed past shortlisting will have a peer review process, and then interviews will take place. The funding committee will then submit their recommendations to the Department of Health and Social Care, and then outcomes will be confirmed with applicants, with awards starting, as I said, between April and October. So what should you include in your application? So as I said, the new application, there's a new application system, but also the application form does look slightly different to previous years. And in terms of your career so far, you can include contextual factors, but within the new application form, there's also a narrative CV template, which must be used, which includes your research outputs and an overview of your career to date, including your contributions and achievements that you've made. We also link through to your ORCID profile, and this is used by reviewers as the source for your publication record. So you must ensure that this is up to date and that you include any key research outputs that you want the reviewers to be aware of. In terms of the award plans, you will include a detailed research plan, as well as a career development and leadership programme, an overview of your community engagement and involvement plans, and research inclusion, which is a new condition of funding within all Global Health Research Awards from 2026. You'll include your support team, which is the mentors, and we advise having between 1 and 4 mentors. And would also suggest that you consider including at least one of these mentors be based within a low and middle income country institution, and also consider other areas as well, so to support things such as community engagement and involvement. You will also include your head of department at both the contracting and partner organisations. There's also an area for the host institution commitment to describe how they will support you through your award, including things like salary recycling, how they will use freed up funds that the award generates in order to increase research capacity, how they will protect your time, including being relieved of administrative tasks, and then ongoing support for you as the applicant beyond the lifetime of the award. Professorships must also include an element of institutional capacity strengthening and this is within the LMIC institutions that you're working with, either your contracting or partner institution. And this should be focused on building long-term sustainable capacity. You're able to use up to 5% of the award budget for this, and activities should be developed in partnership with the LMIC institution in your application. It can include a range of things such as training and development for administrative staff, establishing or strengthening mentoring programs, or strengthening infrastructure and support systems such as IT and library services. So I'll now hand over to Professor Shireen Hussain, who's the co-chair for the committee, who's going to go through what makes a competitive application. Thanks, Shireen.
Thank you, Hayley. And my name is Hayley Shireen, and I'm a professor of health and social care policy at the London School of Hygiene in the UK. I co-chair this funding panel with Professor Harish Nair. So I want to give you a real sense of what the funding committee looks for and what distinguishes applicants that succeed from these than those they don't. This is a very highly competitive award, and I want to make sure that you go in with your eyes open about what the bar looks like. So I'll take you through 4 assessment lenses, which is the applicant, the project, the place, and the global health impact. But first, a few words about the committee itself. Next slide. So the funding committee is made up of academic experts, community engagement and involvement members, and the 2 co-chairs. Applications that pass the initial eligibility screening go to independent external peer review before reaching us. So by the time we assess an application, we have expert reviewer comments alongside our own reading of the application. So basically, our job is to review and assess each application holistically against the published assessment criteria and to make a recommendation on which applicants are recommended for funding. So one practical note, because the diversity of the composition of the committee, just make sure your application is written for a mixed audience coming from different disciplines and from different backgrounds. So not every committee member will be specialized in your precise field. So writing clearly, avoid unnecessary jargon, and always explain why your research matters. Next slide. So just before the individual domains, it's worth flagging 3 qualities that a strong application consistently share. So first, they make a compelling, evidence-based case that the project will genuinely strengthen research capacity and leadership in the setting that it's going to take place. So just when you write, not just assert saying that this will make an impact, but demonstrate with specifics kind of what will make an impact and how. Secondly, the applications clearly explain how the research question was identified and genuine collaboration with your partner or within your setting. And it's not just a pre-driven agenda, especially for those in the UK and partnering with LMIC. It's very important that this is genuinely coming from a real concern of your partner country. Third, the applicants articulate the projected impact of the professorship on the applicant's own career. And this is fundamentally a personal career development award as much as a research grant. So reviewers want to understand what this award will do for you and through you for the field and for the country. So as you draft, my advice would be keep asking yourself, is this specific? Is this evidenced? Is this genuinely partnership driven? So next slide. So we'll talk about the applicant, which is the first domain, is about you. So the committee will assess the likelihood that you will make a long-term contribution to applied health research, capacity building and research leadership in your chosen field and countries. We look at your research outputs and impact and make sure, so that's an advice that Haley have said, you make sure your ORC-ID profile is fully up to date before you submit. We look at your track record in securing funding, assist in the context of your career stage, and we look for an upward trajectory, and that's really important over the last 5 to 10 years. So we're seeing some, kind of traction, but we will take into account career breaks for statutory or personal reasons that make sure that it does not disadvantage you, but we want to see momentum and direction. So critically, we look at the projected impact of the award in your future career. This award is designed for researchers approaching, but not yet at, the status of established leaders. If you are already a globally recognized authority in your area, this may not be the right award for you. We're looking for the next generation of leaders. Next. So the next domain is the project or your research plan. And this is really focused on the program itself. So the committee will assess the quality, the scientific quality of the proposed research and the likelihood that it will attract future external funding in its own and makes impact. A strong project is one that demonstrates you have thought carefully about its long-term sustainability beyond the 5-year award period. So we look at whether the resources claimed are appropriate and whether the total budget represents good value for money. As Haley said, the award is up to 2 million over 5 years, and this is significant public funding, and the committee takes this its stewardship seriously. So be realistic and precise in your costing, and do not overclaim or underjustify. The research proposal needs to demonstrate clear and evidence-based justification for the approach. What is the gap in knowledge you're addressing? Why is this gap important? And what will filling it mean for health outcomes in low middle income populations within the new remit in mind, of course. So your community engagement and involvement approach will be assessed. It needs to be appropriate to your local context and integrated into your study design rather than added as an afterthought. And as Haley highlighted from this year, research inclusion is a condition of funding and should be built into all stages of the research life cycle. So finally, existing collaboration and partnership within LMIC and with LMIC institution are important. So reviewers want to see that partnership are genuine and substantive, not newly formed for the application. Next. Then the third domain is the place or the contracting institution support. So it's your institution, whether it's in the UK or in LMIC. So even the strongest applicant will struggle if their institution does not demonstrate genuine, sustained commitment to that professorship. So we see the letter of support from your contracting organization as critical. So it's not just a formality. It forms part of the eventual research contract and will be monitored throughout the award. So we look for a strong track record for the institution in global health research and evidence of substantive LMIC collaboration. We look also at the institutional commitment to an inclusive and supportive research culture, equality, diversity, and inclusion, and research integrity. And it's not really a tick box compliance. The committee takes a genuine interest in whether your institution is a place where people can thrive. So we look for the commitment of host and partner institution to enabling research uptake, not just producing research, but ensuring findings get used. So the impact is important. Next. And then the fourth domain focuses on your leadership and development program. So a distinctive and central feature of the professorship. This is, after all, a career development award. So the committee wants to see a strong structured development program with a focus on the skills you will need to progress as a research leader. This means it must be tailored to you, your existing strengths and the specific gaps you need to address. A generic list of activities will not impress. It has to be linked to your career trajectory, how that would enhance your chances, and which area you have identified that you need further development. And here, mentorship is key. And as Haley said, you can have between 1 and up to 4 mentors, and we strongly encourage you to include mentors, of course, based at the LMIC institution if you are applying from UK. The mentoring structure should be designed in genuine dialogue with your nominated partnership organization and with those mentors. And by the end of the award, NIHR professors are expected to have demonstrated research leadership at the national or international level, and to have actively supported training and capacity strengthening within LMIC institution. So your development plan should map a credible path to that destination. Next. So the final domain underpins everything else. So this is an ODA funded award, and the committee takes ODA eligibility very seriously. So your application must be explicit about which LMIC country or countries in sub-Saharan Africa or South Asia will directly benefit, how we are responding to these countries' development challenges, and how outcomes will promote the health and welfare of people in those settings. And this is a change from previous round. So please address it directly and specifically, and read the new remit very carefully. So we look for evidence that the research focus has been identified as an LMIC priority through partnership and evidence, not driven solely by the applicant's existing interests. And we look for the potential for long-term capacity strengthening in the research produced, in the careers supported, and in the institutional capacity built in low and middle income countries. So I hope this gives you a useful picture of how the committee approaches its work. and we genuinely want to fund strong applications. So please use the guidance documents and attend the support session and seek feedback from your institution and LMIC partners before you submit. Next, Haley, we go to question and answers, I guess. Yeah.
Yes, thanks very much, Shireen. And thank you for everybody for submitting your Q&As. We'll work our way through those now. There's quite a few questions around the level at which people can be when they apply, in terms of being close to professorial level or being already at that professor level. And really what we would consider is that you are close to that level, so that the award would help support you to get to that professorship level if you're not already there. And if you are already a professor, you're only eligible if within the first 5 years of that post. So once you've been a professor for more than 5 years, you would no longer be eligible for this award. For this round, with the delay from usually launching in September, and obviously we've had a pause in the scheme, we are saying that 5 years, you can't have been a professor for more than 5 years as of September 2025. So we are accounting for that delay, but that would be the key thing. And I think there was another question more specifically around if somebody is too much of an established leader. And I think really the key thing is being able to evidence how the professorship would help you make that step change in your career. Shireen, I don't know if there's anything you want to add that the committee would be thinking about in that context.
Yeah, I guess, well, the 5 year is a general kind of ballpark figure, and I appreciate that in different contexts that may mean different things. But what we are looking for is someone who is at that trajectory where they have started to establish themselves, but they need this award both for their career development, to bring in their interest in research and program of work. And then they show the trajectories, how that would help them. So basically, there is no right answer to this. It's really thinking about, you are there, but you need that help, you need that push. And that would establish you in that position, in that topic, and have an impact on the country, on the people that you mentor, and on the topic. So articulating that is really important.
Yeah, thank you, Shireen. And I think, specifically where people are asking, is an associate professorship, would you be eligible? Senior lecturers, yes, yeah. Definitely, as we said.
Yes, definitely, yes, yeah. I think what we, just from insight from the committee members, sometimes we see someone who has been a professor just under 5 years, so technically eligible, but they are actually leaders. And questions will be raised whether that would help them, or if they would apply for a research project, for example, researcher-led global health research or a partnership. So that we take that seriously. We want that kind of giving that push to people.
Yeah, no, definitely. And I think, as you mentioned, Shireen, that we do recognise that, people are working in many different contexts, and situations are very different. People's career paths have been different. So if you do have any specific questions or you're concerned, then please do reach out to us. The email's on the screen here, and we are willing, able to talk about specific.
Yeah, and Haley, to that point, the narrative CV is a really good opportunity to do that. And I really love the narrative CV because it goes beyond the kind of usual academic route, and you can bring in experience from different sectors, from professional working. And it's a really good place to highlight where you are in the narrative CV.
Yeah, no, that's a good point. With that new element of the application, people can use that to their advantage, definitely. I think
I think there was a technical question I'm happy to take about the funding committee not review for shortlisting. So we see we have a meeting of the shortlisting, but the actual committee discussion happen after those who have been shortlisted, and we actually got the reviewers for them. So we do see all the applications, and we have a discussion around the shortlisting.
Yeah, thank you, Shireen. I think there's a question around community engagement and involvement, which is probably useful for people to answer. So we would expect that the community has been, that applicants involve the community at the earliest possible opportunity, and that they are included throughout the research process. I think as a minimum, we would expect that you would have evidence of a budget for CEI, and that you have access to an involvement of existing groups or communities, even in the formation of your research question, your research project, and have a clear CEI plan. But in terms of obviously the time between now and the application deadline, we do just need to see evidence of your plans of it and that you've had those early discussions. Shireen, is there anything you would?
Yeah, I think generally speaking, if people think about a proposal, whether it's for this or something else, and they only start when it's advertised, this is too little. So I think what we're looking for is that we see evidence of previous engagement, even if it's going to be tweaked or you're going to increase your engagement with certain groups. But definitely we want to see that you have been engaged in that topic and you have identified it. And then, as Haley said, you have a clear plan and budget for that. So some advice I had many years ago, and it was actually from the NIH in the States, you start almost a year before. It's not, if you wait for, it's usually 2 months or 3 months between, 2 months always between the advertisement and the deadline. So yes, I think you need to work these things through what you have been doing before. And that actually links to the trajectories we were talking about.
No, definitely. Thank you. I think there's a couple of questions as well around like the FTE expectations and salary recycling that probably fit together. But the award funds 100% of your salary as the professor. But we understand that the £2 million award is, not a lot of money in terms of research projects. So if you're working on other research projects, that's absolutely fine. You can continue to do so, but we would fund your salary to continue working in different projects. And that's where we consider then the salary recycling. So funding that has already been allocated for your salary, your contracting organisation should evidence how they're going to utilise that freed up funding. But yeah, Shireen, is there anything?
Yeah, just to highlight that this is career development, kind of funding. So we really want you to focus and to be able to do what you want to do and to achieve it. So I appreciate that funding and budget is always tricky. So you would want to have people who help you, but you really focus on really protecting your time. And this is a very good opportunity. And we want to see from HRIs that they will protect your time. So usually people take a lot of administrative and management roles. You need to show that they will be released from those to focus on the research. So don't cut your FT to get a research fellow to balance the budget. Yeah, you need some research assistant to help you, but really protect your time. It's an opportunity that might not come often. So when you do a research project, you might not be able to put yourself more than 10-20%. So I would say think of a good percentage that is protected. Sometimes we see that an institution would provide in-kind further FTE to protect your time and balance the budget. So this is a way of just making the money goes further and you have the team that could enable you to deliver the research.
Yeah, brilliant. Thank you, Shireen. There's also quite a few questions around the contracting organisation and this element of it, which we can provide some clarity on. So you should apply from the organisation that will be your substantive employer through the lifetime of the award. So it's absolutely fine if you are planning to move, but that organisation will have to be included in your application and highlight how they will support you and maintain your contract throughout the lifetime of the award. And in terms of, there's questions around like joint applications with UK LMIC institutions. As this is a personal award, there aren't joint leads and things like that. So we would expect, as I say, you to apply from your current employer, your substantive employer, but you are able to, as we say, include other institutions as partners as well. And I think there was a specific question as well, can you apply with an institution that has a collaboration agreement with your employing organisation? And the answer there would be that, again, you should apply from your substantive employer, but you can include partner organisations. There are some questions around the new remit as well. I think that would be helpful to go into, Shireen. So there's a question around when we say about maternal neonatal health, does this only have to be on infectious diseases? No, this applies across the whole, across any research.
Yes. Yeah, I think this is a new thing, and I think it will take a bit of time for people to get used to it. So the focus is really on health security, and part of that, of course, infectious diseases and pandemic. And yes, if you are thinking about maternal health, you have to link it to the remit. So you have to make a case why this should be funded within these constraints. So every funding, program will have its specific remit. So you need to make the case why you think this is applicable to the remit. And similarly, the geographical focus now is different. So it's just not enough to say this is going to happen in a sub-Saharan Africa, but sub-Saharan African country, but why it's going to benefit that country and what makes that country important to address that. So it might need that you go through this in a more detailed thinking, and NIHR is very helpful to answer questions specific to the remit. If you have very specific questions, we would be more than happy to look into it and advise if we could.
No, definitely. I think, recognizing that this is a big shift in terms of the remit of the call, we are more than happy to answer any questions that you have. So please do reach out to us. There is also a question around whether all the research needs to be done in the low middle income country. We would expect that the majority of the work is done within the countries, the low middle income countries in your application. But if there are elements of research that need to be undertaken outside of that, then it must be extremely well justified. And you also should consider making it clear how that work will still benefit people within the low middle income country in your application. An example of where you might need to do this is specific expertise or specialist equipment, for example, that's not available, but it should be made clear in your application how the primary benefit will still be to the people and populations within the low middle income country.
Yes, absolutely. So this is ODA funding. It has to be for the benefit of the low and middle income countries. And Haley answered that question very well. So yes, there will be component of the work that might be conducted in the UK, or maybe there is a visit from your partner organization to do that. But the vast majority, we expect the vast majority of the work will be focused on the country of choice and will benefit the country of choice.
Brilliant, thank you. There's a few more questions around the level at which people can apply, and I think there's one particularly around somebody with a lecturer, but is not at a senior level. And I think just highlight that we have also launched, or will be launching as well tomorrow, the Global Advanced Fellowship, which is a postdoctoral award which covers anything from submitting your PhD to, being at that professor level. So that's also something to consider applying to. But this one probably, Shireen, if you were able to come in on, will senior lecturers be in a disadvantageous position if they apply and compete with more senior professors, for example, who have more research outputs?
I would say not really if they are at that trajectory. So it's not important the title, but what's the sort of work that you've done? What is your career pathway? What do you expect that you will be doing in the next 5 years? So we're not really, we understand that titles are different across different countries and may not mean a lot. So actually senior lecturers in some countries might be already operating at an entry level, professor level somewhere else. So I think do not be worried as long as you feel you are in a position for that trajectory. So if you are still feel, no, I haven't done enough research or I'm still in the kind of the advanced fellowship, so apply for the advanced fellowship. But don't worry about feeling that the competition. We look at that very carefully. We look at your career pathway. We look at your research project, but also the plans that you put. And I would say use the mentorship very tactically. So what is the mentorship team? Have you put a strong mentorship team? How are they going to help you and in which areas and which aspects and how these aspects will combine together to move you across the next phase. So yeah, don't worry about that. And there was another question maybe related around taking career breaks, etc. The same thing, you have an opportunity to explain the circumstances that you might have been through. And at the end of the day, if you feel, regardless of what has been happening before, you are at that point, I think that's the question, then there is no problem. We can assess it in that way. But if you feel that, no, I need a few more years to be in that position and that trajectory to move on in the next 5 years to become a leader in that area, then maybe this is not for you. So that would be my advice. The NIHR, I have to say, have been doing fantastic work in working with, because I understand that an institution in low and middle income countries may not have the same capabilities or experience like UK-based institutions. So there has been a number of things that we try to do to fairly think about and holistically think about how we can assess someone from a low middle income country against people who are primarily based in UK institutions and collaborating with LMIC. So we're taking that seriously, and NIHR has been very helpful in providing guidance around that. For example, who we will interview, if there are numbers, limited number, but there are equal, that there is some from LMIC, maybe we can try to uplift some of those for the interview process. NIHR support with mock interviews if you come to that point. So there is quite a lot of support if you contact us. So that's just to assure you that we appreciate that it's the picture is different in different countries, and we try to take that into account as much as possible.
Yeah, thank you, Shireen. That's really helpful for people to have that information. But yeah, I think the key thing is that the committee does view your application individually, not comparing to others and the opportunities that others have had. But again, if you are concerned or have any issues around those contextual factors, please do reach out to us, and we're happy to provide any guidance or support we can. There's a couple of questions around that kind of indicate similar things of how much we expect people to split their time between the UK and the low and middle income country. There isn't a specific percentage or proportion that we would expect people to aim for, but again, it's specific to the application, and the committee will consider your approach to the research and how you're how much time you're spending and where in the country where you're undertaking the research and how embedded you are within that research team and things like that. So I don't know if there's anything, Shireen, you would like to add to that.
Yeah, no, it's really think about holistically if this is a strong application. So there are a number of questions about salary recovery and whether, because arrangements are different in different HIs. So for example, if someone is already paid the full salary by the contracting institution, they may use of that part of that salary. So say you've got funding for 50%, they use part of that salary to support other researchers to work with you. That's fine. And that's what we call in-kind contribution. That would be explained in the letter of support. And there is no strict, answers about what you do with that salary recovery. We have to look at the application and holistically look at what you've put for your time and the support mechanisms around you, and whether that will allow you to be able to deliver both in terms of your career development and the kind of producing and delivering the research that you are set out to do, including the types of engagement and feedback loops that you have kind of put into your work. So there is no strict answer. Just be clear, I would say, explain. If you feel that there is something that could raise question, explain it and justify it and assure the committee when they do the readings that actually you've put things in place, mitigating, kind of plans in place to make sure that you will be able to deliver that, and everything else that we spoke about.
Yeah, no, that's great. Thank you. And probably just coming on to the last couple of questions now as we come to the end of the time, but there was a question around whether it will be a strength or a weakness to include 2 to 3 low and middle income countries as opposed to just one. Shireen, is there anything?
It's again how you link as actually there is, it depends if you're in a low and middle income country, we're saying that it will be a positive thing, but if it's justified that you have other South learning. So it really depends how it's not about the numbers, so just a bottom answer, but it's about how that would work. So for example, if you identify that there's similar problems happening in different countries and you want to use that opportunity to have cross-country learning, and you have the partnership and engagement existing in these countries, and you provide a clear plan of how the communication would happen and how the learning could happen, this is great. Definitely that's a strength. But if you just say we are going to use, learning from one country and then use it for others, impact, yeah, but how? So that it's always justifying and making clear the case. But it's not going to disadvantage someone who is doing the research in one country. So it's not like just a tick box. This is doing more benefit for more countries. So, hey, this takes a better score. It's about that specific proposal. Is it well justified? It's well grounded. Has it come through genuine engagement and understanding of the situation of the context? Then that would score higher. So I wouldn't worry if you already have the engagement happening at a regional level and you're able to justify it. But if you feel that it's actually better to focus on one country, that's fine. That's up to you.
Brilliant. Thank you, Shireen. I think that's probably all we have time for today, but thank you so much everyone for joining us and for your questions, helping us to think, answer those and think a little bit more about the awards. And thank you, Shireen, for your time and your consideration in answering all those questions. And we look forward to receiving applications from you, hopefully. And best of luck if you do decide to apply. But thank you very much, everybody.
Yeah, thank you. And best of luck, as Haley said. We look forward to receiving your applications. Take care, everyone.
Thank you. Bye.